welcome back. Today's topic is edema management, which is Coban wrap. Are you guys ready to learn something today? The first one is the description of edema and Coban wrap. So, what is edema? Do you guys know about it? Based on Medical Dictionary on 2009, edema is a condition of abnormally large fluid volume in the circulatory system or in tissues between the body cells. The severity of edema are divided into three, which are acute, subacute, and also chronic. However, for this video, we will focus more on the acute stage. So, what is the management of acute edema? The first one is RICE, which is rest, ice, compression, and also elevation, which can be used for 24 to 72 hours after injury. Other than that is massage and compression, which includes garment, Coban and bandage, and also kinesio tape. The suitability and usage of the Coban wrap will be explained more in this video. Do you ever heard about Coban wrap? These are some pictures that may give you an idea about what is Coban wrap. Based on the Medical Dictionary on 2009, it is a self-adherent compression bandage which used for protection and edema control.
One of the specific features of Coban self-adherent bandage is it is made of porous structure, non-woven polyester material with strands of urethane coated with cohesive substance. The porous structure of the Coban self-adherent bandage allows ventilation of the wrap area. Next, the non-woven polyester material gives the properties of water repellent, strength, high flexibility, and also lightweight, while the cohesive substance allows the Coban wrap to only stick on itself rather than stick on skin. And lastly, it is available in many sizes and also colors. There are few main purposes in using Coban self-adherent bandage. First, it gives high compression in the treatment of venous leg ulcer. Next, it helps to retain all the dressings and bandages that are being applied for a condition such as atopic eczema. Moreover, it gives support bandage for various parts of the body. It also helps in immobilizing extremities such as fingers, while it can securing devices such as spleen. So when we talk about theories behind Coban self-adherent bandage, it uses the same theory and concept such as compression garment. According to Hedgeman et al. 2018, compression garments are the most common and consistently used treatment throughout the majority of acute and chronic cases of edema, while such garments are assumed to promote more consistent flow of fluid while limiting cumulative swelling in patient. Compression garments are designed to reduce circumferential volume by propelling fluid flow proximally along the edematous limb through the application of higher than normal external pressure. Typical pressure delivered by a commercial length edema compression sleeve range from 15 to 16 mm mercury depending on the classes of sleeve. Pressures within this particular range are used for the development and application of compression sleeve, as they have been shown to counteract the disparity between capillary filtration and drainage rates that leads to progressive limb swelling.
On how to conduct this intervention, we need scissors and Coban wrap. For the first step, choose the appropriate width of bandage, which show that the narrower the bandage, the greater the pressure. Then, place the Coban bandage at the distal end of the limb or digit and wrap it to the proximal part. The Coban needs to stretch about half of the maximum stretch, which is 50%, and wrap it from the tip of the finger to the base. The tip of the finger should be left open so we can observe the skin color and preserve blood circulation. Wrap in a spiral motion overlapping 50% so that the fluid can flow evenly back toward the body and not be trapped in pockets of unwrapped tissue. Thus, make sure that the wrap is not too tight for the patient. Thus, make sure that the wrap is not too tight for the patient. Thus, make sure that the wrap is not too tight for the patient. 1 inch 3M Coban is used for the digit part.
digits were wrapped so that only the tips of the digit were exposed in a fashion that would allow for tip-to-tip prehension. While hand and wrist were wrapped using a figure 8 pattern. While hand and wrist were wrapped using a figure 8 pattern.
The first article determined the effects of 3-meter Coban self-adherent wraps on edema and functions in a 59-year-old male with newly skin-grafted dorsally bent hands. It was found that the Coban wraps were effective in reducing edema in the skin-grafted hand after the skin grafting. The next article determined the effectiveness of different methods of compressions for the management of hand edema following a burn injury. It was found that both methods of applying Coban resulted in significantly greater reductions edema compared to the generic compression glove. Lastly, this article states that Coban wraps are an alternative for acute edema or edema prevention for small areas such as the digits. It also states that wraps need to be used carefully to avoid a tonic effect, and patients applying wrap themselves must be instructed not to pull on the wrap when applying for risk of restricting circulation.